they pretty much shut it down and was like, oh no, I don't think anybody wants to know about that. And I really, really had to ask myself, I know that I am not the only person out here dealing with this. And I know it's like kind of embarrassing to talk about, and you know, a lot of women don't feel comfortable even talking to their husbands about it or to people about it, but I just said, you know what, I am on this show. This is a great platform to really just put it out there and let people know that they are not alone. And when you look on my Instagram, I don't look like I suffer from fibroids. I look fabulous on my Instagram because I know how to make myself look good on Instagram, but in real life, I was completely exhausted. I was miserable to be around. I literally had to drag myself to film every day. Noelle can tell you I was in a bad mood all the time because most of the time I was on my period. My period would last sometimes for like 7 days, 8 days. And, you know, and before that, as you guys know, I was PMSing. So, you know, we're really right before the period. When the period comes, that's the easy part. 4 days leading up to it when you want to kill somebody. And then you have like 1 week where you feel normal. And, you know, my sex life sucked. And, you know, I was married to a Jamaican man, so he wanted some. And I just didn't have the energy, or, you know, if I wasn't on my period, I didn't have the energy because, you know, I work full time as well. So I kept going back to the network and I kept saying, listen, you guys have to, this is my reality, I'm on a reality show, please let me talk about this. I'm not embarrassed about it. You know, I know there's a lot of women that are suffering, so it was one of the best things I ever did. I can't tell you everywhere I go how many women come up to me and say, thank you for doing this. Their husbands thank me for convincing their wives to do it. And after, you know, just share the story, because it didn't just affect me, it affected Peter as well, it affected Noelle, it affected my whole world. And since I had the UFE procedure, which was super easy and painless, I mean, I was back filming like probably the 3rd day. Probably could have went, honestly, the 2nd day, but I wanted to just give myself 2 days to rest up. After probably about a couple of months, my period started normalizing now. I just turned 50. I don't know if you guys know that's how.
Beautiful.
But anyway, I actually still have a period still. So with that said, it is normal, you know, maybe 4 days. It's definitely under control. I no longer have a bloated stomach or any of those things anymore. And when I recently went to a checkup with my doctor, I'm not even anemic anymore, and I was severely anemic before that. And like I literally was like, can you check again? Because every time I go, I always expect them to come and go, okay, well, you know you're anemic, you gotta take your iron. And she was like, I was like, you're not gonna give me iron pills? She's like, why? You're not anemic. I was like, are you sure? Because I've been anemic so long, I didn't even know I could not be anemic. So with that said, it changed my life. And I don't know, I assume some of you out here are, you know, dealing with fibroids. I say, please get help. Just get it done. It is the best thing you will ever do for yourself and everyone around you. I feel great now. I have so much more energy. And I feel like I look better. I mean, I was starting, you know, coming from a modeling background, I started being insecure about my body and everything because no matter what I did, I just had like a fat stomach from fibroids. And I think my fibroids, about the size of a grapefruit, Dr. Goodman?
Yeah, the size of about a 4-month pregnant.
Yeah, pretty much. So I highly recommend it. I really, really stand by, which is why I'm here, because it was life-changing for me.
Thank you, Cynthia. And I'd like to thank you so much. Dr. Lipton, I'd like to talk about Cynthia's case before we talk in generalities, but I did want to bring you into this, Dr. Taylor. We're sharing mics here, it looks like. If you just talk to us about fibroids, what they are, because there are probably some people who their only knowledge of them would be through Real Housewives and Cynthia's experience.
Well, first of all, the big issue is fibroids are about estrogen. It's the thing that fuels it, it's the thing that creates it, and it's what you guys produce. So they're non-cancerous growths. We use tumor, but they're not cancerous, and they're growths in the uterus. They can be in any location in the uterus, even pedunculated, which means they can hang outside the uterus. And the biggest issue is that they're fed by blood, but estrogen drives them. So, like breast cancer is about estrogen, fibroids are about estrogen. So basically having things that produce more estrogen than normal, maybe increased weight, or taking estrogen, i.e., hormone replacement, estrogen, soy, exactly. All these things fuel fibroids and they cause them to grow. Simple as that. One of the things I'd like to say is that John Lipton is an amazing person. I've known him for a long time, and I've shown a lot of patients to him, and they all come back like, that's amazing. But the bottom line is, it is a life-changing problem with fibroids. There is no good solution to it. This is the best solution to minimally invasive fibroid care. The only other way is, if you didn't want a hysterectomy, is myomectomy, which is still a big surgery.
Okay.
You can actually do laparoscopic, still a big surgery. And with all the risks and complications of it, it's bad. And the catch-22 to it is, they're gonna grow back. Whereas when you take this, they're not coming back, they're gone. Take out the blood supply, they're gone. So it's the best alternative. And one of the things I always say is, you should not suffer in silence. You hear me? I've delivered 3,000 babies, and I've convinced half of them to get rid of their fibroids. Simple as that. Because it's destroying your life. It's horrible, you feel miserable, you don't even know how good you feel until you get rid of them, and then you get your blood supply back, and your energy back, and you're like, I didn't realize I felt that bad. So don't suffer in silence. You know, do something about it. It's something now out there that you can actually do that's not putting your life at extreme risk.
Well said, well said.
Yes.
And Dr. Lipman, I shared with Dr. Lipman that about 18 years ago, I actually had a myomectomy. It was before I had my child. This was not an option. I was not told that this was an option. And had I known, perhaps my path, my journey would have been different. So talk to us about UFE.
Okay. Well, UFE, uterine fibroid embolization, it's a completely non-surgical procedure. And I've been doing it over 20 years now. So the biggest problem, and one of the reasons why we're here, is that most women suffering with fibroids never hear about it. Never given them as an option. Never. And they will go to their physician, and the physician's well-meaning, but they will not say that UFE is an option. They will talk about the surgical options. They may talk about dietary important things. Estrogen fuels fibroids, as Dr. Taylor mentioned. So we will start sometimes with patients trying to have them avoid the big hormone. I mean, it's impossible to avoid all hormones if they're pervasive, but the big offenders are red meat, chicken, dairy. So you can try to do some things to modify your estrogen. You can slim down and lose excess body fat, because that's a secondary source of estrogen. But the bottom line is, a lot of these women need something more. And the something more does not have to be surgery. I see women every day in my office who have said, I didn't want hysterectomy. In fact, I went to 3 different people. They all said I needed hysterectomy. Not one of them mentioned UFE. And fortunately, I saw your website, or I talked to somebody, or I saw Real Housewives, and I'm so thrilled that you've helped so many women. A lot of you will never meet, but you've had such a profound impact, and I'm so glad that have taken this on as your cause, because while it is an embarrassing topic and a lot of people are hands-off like your producers, you had the courage to take it on, and countless women across the country are thanking you, and you'll never meet. But UFE is an outpatient procedure. They come in the day of the procedure. The access is at the top of the right leg. It could be from the wrist, but it's just a way to get into the body. And the uterus has 2 arteries, one on each side, and they each branch like a tree. And the branches get smaller until you get out to like the end of where the leaves of the tree are, if you will, and that's where the fibroids are. And I know what size those tiny branches are, and I can flow direct these tiny particles out to the blood supply of the fibroids to kind of knock it out. So the fibroids lose their blood supply. The big trunk and the main vessels of the uterus stay open, so the uterus stays alive. And we've had numerous children after UFE. That's another thing people will hear. Oh, if you want to have children, you can't have UFE. Again, that's false. Just the other day, we have our 3rd set of twins born after UFE.
Uh-oh, well, now, wait a minute.
Everybody come in the office and go by the bulletin board and you see all these babies like, I didn't know you delivered babies. I'm like, I don't. at their post-UFE babies that patients are so thrilled they send their pictures in. But, so we cut off the blood supply to every fibroid. It doesn't matter if you have 1 or 100. And without a blood supply, these fibroids will soften and shrink, and as they do, the symptoms disappear. And that's one of the other things that, as Cynthia mentioned, sometimes you don't realize how far you've kind of slid into the abyss, because you say, I'm getting older, maybe it's just, I'm turning 40, or, whatever it is, it gradually kind of creeps up on you, and you don't realize until you get it fixed. Like, I should be up here, I've slid down here, but now when you're back, it's like, whoa, I feel great, I look great. It's transformational, and it's one of the biggest breakthroughs in women's health, but yet, after 20 years of doing it, we're still languishing in relative obscurity. Sure.
I want to share something with you guys, which was pretty much my breaking point when I decided I had to do something about it. Peter and I were at a Bravo event in San Francisco doing some promotional stuff for housewives. And we were doing a meet and greet all day, and I was on my cycle. It was maybe about the second day. And, when you're busy, like I had super tampon on, I had a big pad on, I had the granny panties on, okay, had all that going on, okay? So I'm taking pictures all day, and, it just got to the point where I figured, okay, once I get, to the room, I can kind of, do what I need to do. I felt like I was still covered and protected. Time just pretty much got away. We ended up going from the photos to dinner. And I remember getting up after dinner, and I stood up, and I just felt like this whoosh in my hair. You know what I'm talking about? And I was like paralyzed, because all of a sudden then I started feeling blood coming down my legs. Okay? So Peter's like, what's wrong? What's wrong? I was like, I have to go to the bathroom. And there was nothing I could do, because it was already happening. And I remember getting up, walking out the restaurant to the elevator. Now at this point, I'm leaving a trail of blood at this point. Peter is mortified, because he's embarrassed. It's like I'm walking. And it's the crazy thing is, I was running into people as I was walking out, and they were recognizing me from the show. So they're like, oh my God, hey Sonny, can I take a picture? And I'm like, they didn't even notice I was bleeding. They just I was like, no, I can't take a picture right now. They never looked down, they were just looking at my face. So I get in the elevator to go to the room, because at this point I just need to go, just take a shower, whatever I need to do. And there was like pretty much a pool of blood in the elevator by the time we got off. And then all the way to the room. And I got in the shower and I just broke down. And he was like, you have to do something. You cannot live like this. It was the most embarrassing thing. I was just so tired of dealing with it. Peter had to call downstairs and say, hey, can you have somebody go to elevator number 3? My wife bled all in it. There's a bunch of blood there. There's blood in the hallway. It was embarrassing, because you don't even know who we were. So I was like, okay, Cynthia Bailey's up here bleeding all over the hotel, restaurant. So that was a huge breaking point for me, and I knew that I had to have some options. And my mother had fibroids, and when she was coming along, they didn't have UFE, so she had a hysterectomy, and she suffered a lot of symptoms from that hysterectomy. She really, really did. Her whole menopause thing was just very different from what I'm going to go through. When I get to that, she was depressed. It just really did not help her spirit after she had it done. Something definitely happened to her spiritually. And she wishes that she had the option to do it. So I just wanted to share that. And also, I wanted to just kind of speak to the cravings. When I tell you, I knew every crushed ice place in Atlanta. Yes. I can't even take Sonic, got good crushed ice. BP, got good crushed ice. Let Peter come home with a cup of crushed ice. We would have full-on arguments about ice. I chewed ice all the time. It was ridiculous. I was like an ice expert, but I knew hospitals got good crushed ice. They got good soft crushed ice. So I craved weird things, because you were talking about diet, because I had read up on it. It's okay, if I don't eat, I like meat, I like chicken, I like all the stuff that feeds on it. So cutting all that out was not going to be a real option for me. I mean, if I had to, I just wanted something that was a little more permanent, didn't depend on me not having to eat things that I enjoy eating, you know, for the most part. Even if I eat it in moderation, you know, it just seemed like as I got older, they just kept getting worse. So with that said, I remember craving like chalk. I don't know why I craved that. I guess that was like an anemic thing. And then it got to the point where I started just craving dirt, like red dirt. Like when I tell you, I'm from Alabama, so driving from Atlanta one time, I saw all this red dirt in a field. I was like, oh my God. Can you pull over? I need to eat some of this dirt. I was like, I have lost my damn mind with these fibroids. And I really didn't see anything wrong with pulling over, walking out to the field, and getting a handful of dirt and eating it. I had completely lost it. The cravings had just taken over my body, and it was an issue if I couldn't get to things that I wanted to get to. So it was awful.
What Cynthia is referring to is called pica. There are a number of signs of anemia, being tired, being weak. You may get brain fog, kind of cloudy thinking. You might get migraine-like headaches. We see a lot of patients with migraines, and they're like on all sorts of migraine medicine. They don't need any of that. They need their fibroids treated. They're anemic, they're bleeding too heavily, they're putting out way too much blood each month, and so they lose all this iron and hemoglobin, so they're anemic. So tired, headaches, palpitations, the heart races, has to work a little bit harder. The chewing and craving ice is huge, because I'll ask patients, do you chew or crave ice? They're like, yeah, how did you know? Like I'm looking through their soul or something. Well, it's because you're bleeding so much, I figure you're probably anemic. And then the pica, eating dirt, clay, there's the Georgia white clay, it's crunchy. That's from really severe anemia. When you're severely anemic, in fact, there was an AJC article that talked about all the crazy Georgia white clay eaters, and they probably had fibroids, but they didn't even mention that. All they mentioned was how odd it was to eat clay. They didn't make the connection. It's due to severe anemia, and probably if they were female, it was due to fibroids.
Dr. Tiller, if you could, and you have got the mic just in time, if you could talk more about the symptoms, because by the point, Cynthia, you decided I've got to do something about this, it was quite severe. But I've often heard women, in particular African American women who suffer from this, from fibroids a great deal, until they moved to Atlanta, and that was my case, no one ever diagnosed me with fibroids. And I hear that oftentimes. That's what are some of the symptoms that perhaps might not be as severe a case that indicate that something's wrong.
Well, the honest opinion is I practiced gynecology for like 25, 30 years. The reality is the reason why you don't hear this option is because of one big thing, money. Yep. There you go, you got it. Because if they are telling you things they can make money off of, right? And they're not trying to convince you to do something they can't make money. So when anytime you see something that's kind of quirky in life, period, follow the dollar. It's always going to be because of money. The problem is about 85% of African American women actually do have some form of fibroids. And about 65% of them are symptomatic, which means that they actually have pain, bleeding, the whole issue. So when your cycle, you can have actually abnormal cycles, but 90% of the time your abnormal cycles are probably due to fibroids. And the size of the fibroid doesn't necessarily mean anything. A large fibroid can be bad, but a small one in the wrong location can be just as bad. So, or worse, correct. So at the end of the day, it's location of the fibroid which tends to cause most of the symptoms. If you're trying to lose weight and get that body back, very difficult, because if you have really large fibroids, you know, it actually causes bloating, it pushes on other organs, and basically it makes your life miserable. So at the end of the day, like I said, we don't really have, up until now, a real solution to it. And, you know, basically women had to just suffer in silence, because you would go to the doctor and you say, well, yeah, we can cut them out, but I want to have a kid. Well, we can just take them out. But remember, anytime you basically are going in and disrupting the lining of the uterus, you're running the risk of not getting pregnant. period. Simple as that. So when they tell you, basically, well, we can go in and do a myomectomy and we can, get you back and you can have a baby, it's really not a good idea. I mean, well, the risk of you not getting pregnant is there. Whereas in this scenario, you're not going in, you're not cutting the myometrium, you're not basically making the uterus weak, you're not disrupting the endometrial lining that basically will prevent implantation of the egg. Basically, it's just slowly taking it out without disruption of the anatomy of the uterus, which that's the real cool thing about it. So as you ponder and think, this conversation has made me kind of wonder, what should I do? Well, one, you should basically do as much reading and information as you can. The educated consumer is the person that you want to be. You want to be that person who knows more about your condition, probably more than most doctors, because you have read everything, you know everything, you've seen the options. And once you recognize these options, you will basically realize a better scenario would be not to disrupt the uterus, not to cut the uterus, not to disrupt the lining of the uterus, and you can go back to work in 3 or 4 days versus 6 weeks after I do a nice large incision. And even if we do, because I do aesthetics now, so putting 3 holes inside your belly to get out a fibroid doesn't work well for a lot of women. Because they're like, oh, well, I didn't get the incision, which I can hide in your waistline, but having 3 different holes in your belly, they didn't realize how aesthetically it wasn't going to be warm and fuzzy. And because a lot of black women basically have keloids, so even if you put a small incision, it's going to be a problem. So the alternative is basically put you into menopause, to shrink the fibroids by taking off the estrogen. And now we worry the risk of you not having good bone health and hot flashes, all the things that come with menopause. So there's no good solution to this. And to add that, it doesn't change a thing. After you basically shrink them, they grow right back. So don't let anybody talk to you into giving you medicine that's going to shrink the fibroids. It's not going to happen. They're going to come right back because estrogen drives the flow. And if you block estrogen, you're in menopause.
No ifs, ands, or
I have a
buts.
question for the two of you, Cynthia, Dr. Lippman. Dr. Lippman, of course, the first time some of us in the room were introduced to you was through Real Housewives. How did the two of you connect?
Do you remember? Did I reach out to you or did you reach out to me? When I Googled fibroids, he was the first person that came up. And then I started reading all this stuff, like he was like, did the first one, whatever. And I was like, okay, well, he must be the best. So I reached out to him, and then I also said, I want to get this done in real life, because I have my TV life in real life. But would you be open to filming this with me, getting this procedure done? And he was like, okay, yeah, I can think about doing that, whatever. So, yeah, and then we went on to go to the doctors as well. And I talked about it on there, Dr. Lippman joined me there as well. And that was great. That was a great platform as well to just, put it out there and just make women feel more comfortable talking about it.
And I can only imagine the response that you've received since the series has aired, season 6, and so many people not knowing that this was an option, and how well and beautiful you're doing, and like it's like a new lease on life, being able to live your life without fear or concern.
I think the words were, I got my sexy back, is that
Well, you never lost your sex, really, yeah, folks in this
No, I lost it when I had those fibroids. I didn't feel sexy. I mean, it looked sexy a little bit, but I feel like I really felt like I lost a lot of important years when I was dealing with that, because I'm 50 years old now, and I feel like I look better than I think I did in my 30s when I was dealing with all of that. And although I was younger, I look back and I'm like, I could see, dark circles under my eyes. I was tired because I wasn't, really, sleeping well. Like my whole body was disrupted. And, the Real Housewives of Atlanta is a drama-based show. The purpose of our show is to entertain you guys. And, every now and then we get an opportunity to kind of educate you guys on some things as well. But we have to be pretty transparent with it. And this is one of those situations where, it was just worth it to me. I mean, I could live my life and no one had know I had fibroids. It was a hot mess bleeding all over Atlanta. But the problem was bigger than me. I felt like I had a responsibility to put it out there. And I will say, I've been on, The Real Housewives of Atlanta has been on this will be our 10th season that we're filming now. I've been on for 8 years. And I will say, talking about fibroids was definitely one of my proudest moments. I can look back and say, you know what, I helped somebody watched this and somebody did something about it because I, just was brave enough to talk about it. And to be very honest with you, I'm not the only one on the show that has fibroids. A lot of my other castmates have them, but they were not comfortable, talking about it. That's just not what they felt comfortable doing. And that's fine, I was fine talking. I can be fibro-related, as long as, as long as I was, I just wanted an answer. And I was so excited to get my life back that I wanted to share it. It just wasn't something that that I was going to continue to be embarrassed about. It was very liberating. And again, I'm a changed person since I got it.
One side note is that, and I do see there are some men here tonight, it does affect men, as you mentioned. And the men oftentimes don't understand. If you watch the show and you saw how, from Peter's aspect, it seemed he was like, well, she must not love me anymore because, I'm not getting mine, and it must be because she doesn't love me. And it's like, no, that's not it at all. Cynthia, obviously, you love Peter, and it was men not understanding what you were going through, and to see like that him come around on that, like, wow, like I didn't know all of this, and that helped that helped the men kind of understand, because obviously Peter's not alone in this. There are a lot of men that have no idea about any of what women go through, and so it was really important for him as well to kind of bring the men along on that journey, because otherwise there'd still be a lot of problems with that.
Yeah, I think a lot of people's husbands and, significant others or boyfriends or boos or bays, whatever, I think they felt a lot more comfortable. Well, I think their women felt a lot more comfortable talking to their men about it after they saw Peter and I have serious conversation about it on the show. And, because it's not something men don't want to hear about your period. They don't even want to see anything. They just want, it to happen, go away, and just let them know when it's over. That's all they want to know. When we have sex again? Is it done? That's all they really want to know. They don't want to know about anything in between. And most women, especially us black women, it's like we're concerned. We don't really want to talk about that. That's like our time where we kind of hide that from them. We don't want them to see us in that way. So, yeah, I was glad that Peter actually was very supportive and just, talking about it with me, because he really did go through it with me.
That brings up one additional point, that it's so important, and I'm glad everyone came tonight, is hopefully you'll spread that message too, because women need to talk to their friends, their daughters, because this is a condition that obviously disproportionately affects African American women. And so women have to talk to their family members, their sisters, their daughters. It's got to be a conversation that people feel more comfortable discussing, because, as I say, otherwise you're going to get a hysterectomy. Hysterectomy is the second most common surgical procedure done in the United States. I'll say that again.
Yes.
Hysterectomy is the second most common surgery, yet half the population, I know some people in my office, and some of the people in my office are here, they think I have a uterus. Half the population isn't even eligible for hysterectomy, and it's the second most surgery. And the most common reason why we do hysterectomy in this country is not cancer. If you have uterine cancer, hysterectomy is perfectly appropriate. But the most common reason by far is fibroid tumors, which are benign. And the average age of the women undergoing hysterectomy in this country is less than 40.
Yeah. Yeah.
These are young women. In fact, we do a lot of speaking all over the country on this. Invariably, and maybe someone tonight will come up to me afterwards and usually is in tears, and they're in their 20s, like 26, 27, 28. They have already had a hysterectomy. They didn't want it. They looked for all sorts of opinions, none of which were anything but hysterectomy, and they reluctantly succumbed. And I have daughters that are late 20s, and to think of them without their uterus is tragic, and it just does not have to be. But you've got to be educated. You got to do your homework. You got to, unfortunately, until we can get to the tipping point, and this is just common knowledge, you got to do your homework.
On that note, we're going to open it up for questions because I know there are some of you out there who I would imagine have questions. And unfortunately, given time, we just have time for about 2 questions. So if there's anyone out there, yes, right here.
Hello. Well, first of all, I want to thank Cynthia for being so transparent, because as you were telling the story, I was sitting here checking the box of all the things that I've experienced. But you mentioned that there are certain things that we eat, and this goes to the whole panel, that can impact the growth of the fibroids. Can you share additional things we should avoid?
Well, there's hormones pervasive in the food supply, even in the drinking water, unfortunately. But I was mentioning the 3 big offenders for hormones in food: chicken, red meat, dairy. Now, you can do free range. You can kind of go organic. They're not supposed to plump them up. Whether they cheat or not, I don't know, but they're certainly more expensive. Hopefully they are true to their word. Dairy, you could substitute almond milk instead of cow milk to avoid that. Beef a little harder, because soy, you can try to do soy, but some of the soys, as somebody mentioned, some of the soys have phytoestrogen, plant-derived estrogens in them, so that's a little harder. But invariably, the best thing you could do versus food stuff is to be as lean or close to your ideal body weight as you can. Everybody has their own ideal body weight. If you can be as close to that through exercise and diet, weight loss, you'll shed the extra fat, body fat. That will be the best thing to do for your fibroids, and it will be great for your overall cardiovascular health. Because one of the reasons why people ask me, well, why do African American women have more fibroids than other racial groups? 2 reasons. One, genetically, it runs stronger in African American families. Second, it has to do with body fat. If you look racially at body fat distribution, African American number 1, Asian the lowest, and they have the lowest fibroids. But so it's not it's not just body fat, but it's also genetic. But you can't pick your parents. You can't do anything about that. But everybody can try to be as close to their ideal body weight. That'll be the best thing. Will it take care of everything? No, but it'll make you make the fibroid symptoms better or make your overall health better.
We have time for actually